B on October, and I thought that just to organize this course 4 to 6 weeks before an exam, it gives a good opportunity for people just to reflect what are the things that they need to do in order to ace the critical appraisal. So what I've done is don't worry about the slides. We'll go through that slowly. So today we'll be just covering the research method. The critical appraisal in itself is divided into 3 parts: research method, evidence-based, and bias stats. Bias stats is the one where you need a calculator. But since the exams are arranged through online, they will give you an option, some blank, and there will be also a calculator attached in the real exam. So for today, don't worry about the calculators, but in the next session, make sure that you have a calculator with you, and we'll be doing a lot of stats. This is to do with numbers. So bias stats is that. So I'm just giving a head start. Next week, make sure you have a calculator, and we'll be going through different tables how to do it. So what is expected from this course is the reason why I made this course is for candidates just to have an exam hat. And I'm just focusing on the syllabus which is in the MR side, paper B, and in the syllabus, I'm just sticking up the syllabus, and I've created this course so it becomes easier for you guys to solve the MCQs. Not I haven't given hi-fi things which is not relevant for the exams. Those things you can do it after the exams, and if you are interested in research, you can do a bit of more on reading. So today we'll be going through 120 slides. And that's a lot, but we'll be having 60 slides, and after that we'll be having 15 minutes break and 60 slides later. But the slides are not densely populated, just few things. So I'm just going to highlight the things which is needed and ignore the things which is not needed. Okay. This is just when you prepare for exam, just focus on what is needed. It's not needed for you to know everything from the exam. Okay. So today what we are going to cover is, in the first session, we are going to cover on study design, bias, errors, and experimental study. So this will be covered in 1 hour, 15 minutes. Forget about the rest. That will be covering after the break. So we are only covering three topics. This is the thing that normally have people normally have when they prepare for exam. Where to start the critical appraisal. As people who are appearing in this, I presume you have given paper A. So when you prepare for exam, make sure that what is expected, and also know how much mark is distributed for each part. So in paper B, the total mark is 150. So in 150, 1/3 of the mark is critical appraisal. That is 50 marks. I'm just giving you a head start. When I prepare for paper B, this was very helpful. I divided into 3 chunks. So the critical appraisal will be 50. So this is the thing we'll be focusing. But people for paper B, just to be mindful, there is also 100 marks in the rest of the topic. So if you are studying old age and psychotherapy, it becomes easy. Okay, because some of the knowledge will be interchanged. If you are preparing CAMS and learning disability, most often some of the MCQs might be related. So make sure that you study this chunk together. Forensic and substance, it becomes easier. So this is like 20, 20, 20, and the general adult is 40. So make sure when you prepare for exam, try to see in which are the topics that you can concentrate more. So when I prepare for exam, critical appraisal and the rest of the topic was the thing that I focused. So I make sure that out of 150, I scored like 85 to 90. The general adult, this is hit and miss topic. So the aim should be to get 70% in order to have a confidence that you'll pass paper B. Okay. So this is the thing that I was talking about. In MCQs, 100 will be single based question, 50 will be EMI. In the EMI, there will be 16 EMI. Out of the 16 EMI, in one EMI, there will be a lot of options given, and there will be 3 questions. But make sure in the 3 question, sometimes they will ask, choose one of the options, or 2 of the options, or 3 of the options. So make sure that you read it. Sometimes what happens is, when you do the EMI, you only take one answer. But the thing is, they might ask 2 answers. So make sure you read, how many answers you need before you're taking. Okay, so this will make a difference of 0.1, 0.2. So people tend to fail by 0.1, 0.2. So keep in mind, single based extended question, sometime instead of 1, there might be 2 or 3 options. So keep that in mind. Okay. So I'm not going to go through this, people who have given paper A, they have got the different, strategies, how to prepare for exam. But what I tend to do is I feel more comfortable when I read the theories, with the syllabus theory 2 or 3 days, than do the MCQs. If you do the MCQs, then, there will be a lot of gaps and holes in your knowledge. Then you might struggle. OK, so I would advise that read the theories, do the MCQs. If there are some of the things that is missing, make a note of it. OK, so this is already I've discussed. Now, OK, the materials what to read. I have put a picture over there. So a lot of the things, which I may be saying, it will be like, like a flash. It might go off from your head. So just focus on the things that, I stressed. So these are some of the materials that you can read for paper B. For MCQs, SPMM has got a lot of questions. Mentor is also one of the question bank. So what I would advise is when you're preparing for paper B, at least go 3 rounds, which each rounds you make sure that if you are in the first round, if you are scoring like 70, 75, make sure in the second round you score like 80, 85. Near the exam, make sure you scored like 100. So you cannot miss the question bank. The thing is, out of 65 to 70% of the question will be repeated. So you cannot afford to make mistakes on the repeat question. 30%, if you have got your theoretical knowledge, it will cover it up. So it makes sure that you score on the higher trend of passing exams. There are some of the books which I would recommend for critical appraisal. Dr. Ghoshal book is very good. It's written in a very simple terms, but if the exam is approaching, I would not advise you to just go through the books. Just focus on what is needed for exam. So there are some books you can read after you pass your paper B if you're interested in research. Okay. So today, I'm not going to charge you for asking question. So if there is anything that you are not sure, make sure you stop and we'll have a discussion. When you're preparing for exam, make sure you keep yourself healthy. Sometimes what happens is when you are stressing yourself too much, you don't tend to take care of your physical health. So before exams, like 1 or 2 weeks, make sure that you take a lot of annual leave. Make sure you don't take any extra on-call shift, or you don't do you don't plan things before 1 or 2 weeks before exams, like try to do more presentation, try to do audit, just keep like 2 or 3 weeks free. A good health also helps you to retain the knowledge that you have prepared for the exam. So what happens is when you prepare for exam, your knowledge increase on and on. So at the time of exam, you need to pick, you know. So at the time of exam, what you need to do is if anyone stop you on the road and asks, OK, what is the MCQ of this? You have to say you have to answer with your eyes closed. So that much focus you need to be at the time of exam. So you need to pick at the time of exam. OK, so now we are covering 3 topics. OK, so this is the first topic, study design. So I'm focusing more on the theory side. So once we do the theory, then we'll give a little bit of break and we'll do some MCQs. So from the MCQs, I will also give you some tricks, how to use your theoretical knowledge to answer the MCQs. So we might be aware that when we have a local teaching, we do the critical appraisal. critical appraisal session. So this is just the knowledge, or when we work as a doctor, as a psychiatrist, in a clinical practice, we might be thinking, okay, what is the best evidence to use for the patient? So the first thing we do is ask ourselves, we formulate a clinical question. Second is we assess, we try to find out, okay, what are the evidence based? And after that, we know once we find the evidence, we try to do the critical, which is validate and usefulness, whether this is applicable for my clinical practice or not. Then we try to apply and assess. So this is the cycle which we go on. Okay, so this is the gist of evidence-based medicine. Okay, so when you do your EMI extended question, okay, this is one of the favorite question that they always tend to ask. Okay, so they will give you a lot of options and they will ask, okay, what is the full form of this one? Or it will also come in extended question. So they will say, okay, PICO formula is used in evidence-based formula. Okay, out of the 5 options, okay, which is the full form of P? So they will give 5 options. So if the P comes, P might be patient, population, or problem. But most of the time in the MCQ, it will be population, P, population. When you have a population, then it becomes I, intervention or exposure. What are the medical, surgical, or this is used on the population? That is I. So if they ask for acronym of I, is always intervention. After intervention, you need to compare. Okay, so in compare, you compare with a benchmark. So C becomes compare. O means outcome. What is the element of likelihood that this can be applicable for my clinical practice? So now when like in your exam, imagine in your exam, okay, this is the question, and if they ask, okay, let us say, what is C4? Can anyone answer?
Comparison.
Comparison. Comparison. So like
Comparison.
when you are reading the theory, okay, also ask to ask MCQ question to yourself. So it becomes automatic that when you are in the real exam, you also have the same kind of mindset to ask question, and the answer comes automatically. Okay, so we are going to do one more exercise of this. Okay, there's a PICO is used in the evidence-based question. Okay, out of the 5 option, what is the likely full form of O?
Outcome.
Perfect. Okay, so when you are reading the theoretical knowledge, also link to the MCQs. So in the real exam, have that format. Okay, because in the exam, no one is going to ask you, okay, explain about PICO. Okay, they will not ask, write a paragraph on PICO. So when you're reading the theoretical knowledge, also have the critical mind of thinking, okay, how can this question be asked in the MCQs? Okay, so the second part is now where are the where you do you search the evidence? Okay, when we are lazy, we tend to search from Google, Yahoo or this. But for the critical appraisal, there are some search engine that are useful. Okay, in the real in the exam, these are the search engine that they might ask, and the search engine kind of question, it comes in extended question, not in the single based question. As I said, in the real exam, there are 16 extended question, and this is one of the favorite extended question that they tend to ask every time. So if it is Medline, okay, always keep USA, Medline, USA. If it is a PubMed, okay, is a Medline, but this is the one where you find everything about medicine biotopics. They might also sometimes ask the full form of MES. MES is medicine use in thesaurus or medicine subject heading. So this is one of the MCQ question. So I've said before, when you are reading the theoretical knowledge, just say, okay, how can this be asked in an MCQ? So let us say, okay, what is the full form of MES? So they will give you 5 options. Okay, so which would be the answer?
It'll be medicine subject heading.
Yeah. Okay, so when you're reading the theory, also try to formulate, okay, the MCQ. So now is Chinhal. Okay, Chinhal is used in nursing and applied health literature. When you say applied health literature, just keep in your mind, beside beside doctors, all the professionals fall in applied health literature. So it can be occupational therapy. So keep that in mind. Ambrose, the initial of Ambrose is E. E is European. Okay, that is the way to remember. Ambrose, E is European. Psych info is S. P comes with psychological literature. So try to link, okay, P with P. When you are stressed, you don't remember anything, but just remember psych info, there's a P. So with P, it comes psychological. Okay. SIG is single. That means all the grade literature. Grade literature is the literature which is not published in English. For example, there are some nice paper which might be published in Chinese or India, okay, but it's not published. So those papers which are not published, okay, it all form in SIGLE, okay, and nice is whatever we use in the guidelines. So are we clear of the search engine? So let us do one exercise. Okay, this is the extended question that comes. Okay, I've got an extended question. Let us say. Okay, so are you ready for this one?
Yes.
So this is the extended question, but in the past, there used to be 5 or 6, but now because of 150, there's only 3. Okay, so imagine we are doing 2 extended question. Okay, so over here, okay, what do you think might be the answer?
Sinhal.
Okay, because there's occupational therapy. Okay, in the second one, what do you think?
Nice.
Nice.
Yeah. So when you are looking at the question, so just focus on the thing that what you want to see. Okay, so over here, there's a cardiac and geriatric problem. What do you think is the answer?
Would that be nice again?
No, because there's no any guidelines.
Grey literature.
We'll keep this, we'll just pause this one.
Medline maybe.
Okay, we'll just pause this one. Okay, for now. What is this one?
Cycliffe.
Because P is P. Okay. Effectiveness, drug use. What do you think?
PubMed or Medline.
Okay. And highly controversial novel.
I think this is grey literature.
The grey literature.
If it is, if just remember 2, different language or controversial, just tick this one, don't think twice. In exam, the more you think, the more mistakes you make. So just look at what you want to see. Okay, so let us see the answers. Okay, so we were right in first one, second one. This is concurrent review. So let us go back. Yes. Just remember, if there's any medical, like, medical terms like cardiac failure or medical terms, like kidney or cardiac, just tick on this one.
Cochrane.
Yeah. So before we move, let us just revise. If there is anything beside doctors, if they ask for literature like nursing or occupational, this is the answer. If you see any guidelines, this is the answer. If you see any medical term, this is the answer. If you see any psychological with P, this is the answer. If it is any with medications or effectiveness, this is the answer. If you see any like controversial or different language, this is the answer. Okay, so this is the way you do the MCQs. So can we move to the next topic now?
Yeah.
So in extended question, keep that in mind. Look for what you want to see. This is a balloon operators. Okay, this also comes in extended question. It doesn't come in single base question. Okay, so balloon operators is when you put in a search engine. Okay, and if you want to find 2 topics. Okay, so I think this becomes more clear with the diagram. If it is an, it only use this one, the common. If it is or, then it includes everything. If it is not, it excludes it. Okay, so let us look at travel or tourism. Travel and tourism, it means it needs to include everything, but not wave and wave. Wave means common. Clear with this one? Or means it includes everything from travel and tourism, and means for this, the common between this and this, it includes this one. Okay, and means the common, not means exclude. Okay, so they might trick you by saying that, okay, if you in extended question, if you want to find the common between this and this, only the overlapping and is the thing that you want to find. And is also called default Bubler operator. So keep in mind, and is default, and means common, or means everything, not means exclude. Okay, double quote means if you want to find a very specific word. Asterisk is, for example, if you want to find everything that starts with A, then put A and asterisk, begins with a word. Okay, so are we clear with the balloon operators? And now we are going to do a bit of exercise now. Okay, so can someone answer this one? What is this?
And
Okay,
it's the default operator.
specific phrase.
Inverted commas.
Inverted.
Yeah.
Okay.
Eliminate.
Not.
Not.
Yeah. All the search. All.
Or.
Or.
All. Yeah. Okay. Include with specific test. Specific.
Phrase again. Inverted commas.
Yeah. Okay. At least one of the search engine. At least one. Includes at least one overlapping. Which is the one?
And.
Okay. So like we have done 2 extended question. So in the exam, just look for the things that you need. Default, specific page, eliminate, all search, specific, this. So if you know this, you don't need to read the everything. But keep in mind, sometimes they might put not, they might just change the question. So also be, mindful of reading question. Okay, so I think we have answered all of this. Perfect. Yeah. So if any balloon operators come in the exams in extended question, I hope all 4 of you will answer. You will not miss it. So now we are going in the study design. I think for if you understand this concept of study design, well from the theoretical knowledge, you can answer all the MCQs. Sometimes what happens is there are a lot of MCQs in the study design, but if you don't know the basics, you struggle to answer. Okay, so in the study design, just divide into 2, non-experimental and experimental. Experimental is something where the researchers intervened. Okay, so there are randomized trial and experimental community. So forget about this now for a moment. In this one, population based and individual based. So most of the question will be asked on individual based, not on the population. Okay, so if you are looking for the population, there might be like health survey or ecological study. If you're doing individual studies, descriptive means you all only describe like case report, case series. So we are going to go in detail of each of the studies. Analytical means there is some kind of quasi kind of intervention. Okay, cross sectional. When you hear cross sectional, prevalence means everything included. There's case and control, cohort study. So from this, just remember 2 things. For individual study, there's a descriptive that is defined, case report, case series. For analytical, cross-sectional, case control, and cohort study. Okay, so let us do an MCQs from this one. Okay, out of all of the studies, okay, which study would you describe a descriptive study? Okay, so there will be an MCQs. So the options will be health survey, case control study, cohort study, randomized study. Which do you think is the answer?
Health survey.
Okay, let me just read the question again. Okay, out of all the 5 options, which one is a descriptive individual study? Individual study. Okay, so the options are descriptive, health survey, cross-sectional, case control, cohort, or randomized.
There is no option.
Okay, so let us put this option now. Case report.
It's case report.
Okay, so read the question carefully, So they will put which is the observation study. So if they put population based, out of this will be 1. But if they say individual based, the option will be this one. So they might trick you. So read the question properly. So this is the hierarchical of the research study. So in the MCQs, they will ask, which of the study is a superior study? For superior study, this falls in the lower bottom, animal and laboratory study, case report and case series. It also falls down because the population here will be just 1 person. Then there's a case control study. Okay, I'll come into more detail, but just remember case control is lesser than cohort study. Randomized is better than cohort. Out of randomized, meta-analysis and systemic review is above that, and clinical guidance is the top one. Okay, so let us do an MCQ study. Okay, which one is a superior study? Okay, so the options will be case report, case control, cohort, randomized, and meta-analysis.
Meta-analysis.
Meta-analysis. Okay, so in the exam, just remember this, and sometimes they might trick you by not putting this option, but they will only give this option. Okay, which one is a superior study? Cohort study, case control, case report, case series, or just a narrative review?
Cohort.
Cohort. Okay, so the way I remember in the exam is, which is superior. For case and control, there are 2 words. For cohort, there's only 1 word. So 1 word is better than 2 words. So, like if I get confused or this one, just remember 1 word is better than 2 word. So if they ask me a superior study, I will always take cohort study.
Very helpful. Thank you.
So these are some of the terms which might be tricky when you answer the MCQs, Longitudinal means, for example, there's a group of study, so they might be accessed in, let us say, in 3 months, 6 months, or 9 months. So that is longitudinal study. So the same population is, regularly monitored in months or weeks. So if they put a longitudinal, that means the same population is measured in different times. Okay, so MCQs, when they say longitudinal, there's always one group which is studied in different times. If it is a parallel, that means there's 2 studies. Okay, there is, what is control, one is intervention. Okay, they go side by side. If it is prospective, you can see in prospective there's a P. So always remember, prospective means P is present and it goes forward. Retrospective, it always goes back. If it is pragmatic, that means in the real clinical setting. Okay, so before I go to this one, are these terms clear now? Because it might trick you in your single base question. But let us say they will ask, okay, you know, a group of population is studied, okay, in 3, 6, or 12 weeks. Okay, which of the common terms is applicable for this study? So the option will be longitudinal, parallel, prospective, retrospective, or pragmatic. Which one would you take?
Longitudinal?
Yeah, the same population. Okay, so if you understand the concept, it becomes easier for you to tick. Okay, and for example, population is studied now. Okay, but the outcome we don't know. Okay, but the study is going on. Okay, so which study would, which term is applicable? Is present? We don't know. Prospective. Okay, for example, the outcome has already been, we already know the outcome. Okay, but we don't know the risk which is involved in the past. Which study?
Retrospective.
Retrospective. Okay, so in MCQ, make sure that you put your concept. If it is present, if it goes for prospective, if it goes back, retrospective. If it is two study which goes side by side, it's parallel. Okay, longitudinal, same population in different times. Okay, pragmatic, real. Okay, so this is the single based question that this always troubled me a lot. When I prepare for exam, effectiveness is measured in the real environment. Let us say, you want to find how much olanzapine is effective. Okay, to find that out, that in your clinical practice you prescribe medication for the patient and you check whether it's has made any improvement or not. Okay, you have checked in the real scenario, that is you are checking the effectiveness of a medication. Okay, so this gives, I'm going to come more in terms with validity reflective in the coming slides, but just remember, pragmatic study has got external validity. That means that is more applicable outside. Okay, it can be generalized. Efficacy is something that is done in the laboratory, not in the real scenario. Okay, for the laboratory, internal validity is high. Okay, so let us do one MCQs. Okay, for example, if you want to try olanzapine in the real clinical setting, okay, which is applicable? Effectiveness, efficacy, optimum, reliability, or some option? Which do you think?
Effectiveness.
Effectiveness. Okay. If you want to check certain medication in the laboratory setting, okay, which are the 5 options would you take? Effectiveness, efficacy, reliability, iterator reliability, or something?
Efficacy.
Efficacy. Okay, so in the MCQs, one of the MCQs is um, uh, uh, a laboratory assistant in checking the efficacy of a medication. Okay, out of the 5 options, which of the options is more suitable for this? External validity, internal validity, internal reliability, iterator reliability, or some option?
Efficacy.
Internal validity.
Internal.
Internal validity. Okay, so if it efficacy, internal validity, effectiveness, external validity. The way I remember is, effectiveness is a long word, always external. If it is long, it's always outside, external. Okay, efficacy is a short word, so it's always inside, internal validity. Okay, so this is also one of the single based question which always comes. Okay, so they will ask which are the stages there will be. They will ask phase 1, phase 2, phase 3, phase 4. So phase 1 is in subtheoretical. So let us just think of a vaccine, COVID vaccine. Okay, so for COVID vaccine, small number of people, subtheoretical. This is the first phase that goes. We just want to find out how many people are affected. Then, in the phase 1, the healthy people are compensated and they want to try, whether the vaccine is effectiveness or not. Phase 2, the, effectiveness and safety are checked. In 3, satisfactory and marketing are done. And 4 is after marketing, they just want to find whether it's applicable or not. Okay, so in the simple term, if it comes in the MCQs, let us think of a COVID. If it is in a clinical trial, okay, for example, like Pfizer was in clinical trial, so is phase 3. In fact, Pfizer is tried now for a long time, and they just want to find how effective post-marketing, that is phase 4. Okay, so in MCQs, they will ask, okay, a particular medication has been developed, okay, but they still want to check the effectiveness and safety profile of this. Out of the 5 options, which is phase 1, phase 0, 1, 2, 3, 4, which option would you take?
Phase 4.
To check the effectiveness and safety.
Oh, effectiveness and safety, sorry.
Yeah. Okay, just look for this word. If they say post-marketing, phase 4. If they don't
Sorry, I
mention
thought
anything
well
about
post.
post-marketing, go to 2. Okay, so look at the clues. If they mention anything
Yes.
about hypothesis, go for 4. Is it clear? So when you look at the MCQ, always look for your magic words, to take it. Okay, so this is the thing that I've already, we have done some MCQs. Case report case series is done for a rare disease for poster presentation. For example, in your ward, you find a very rare case which is not there. For example, someone has got Capgras syndrome, which is very rare. So you have found this particular case. This is rare, and you do a poster presentation. That is called case report, or if there's 2 or 3 cases, it's called case series. For cross-sectional study, always remember if you are doing the screening test, like for for depression, there are a lot of screening tests. So anything with screening or diagnostic, cross-sectional. Okay, uh, prevalence means it gives all the population on the particular time. Okay, so in the MCQs, if a screening or prevalence come, close your eyes and take on cross-sectional study. Okay, if screening or prevalence, if you see these 2 words and if they are right, what is the type of a study? Close your eyes and click on cross-sectional study. You'll never go wrong. Clinical audit. If they mention anything of standard to compare, okay, click on audit. Qualitative is, when those things that cannot be measured. If someone write about, experience, feelings, opinion, okay, then is always qualitative. Okay, so let us do a kind of MCQs on this. Okay, for depression, some experimental have found a new screening test. Okay, out of this 5 study, which study is more applicable? Case report, randomized trial, cross-sectional, case cohort, case control, or cohort? Which do you think is the answer?
Cross-sectional.
Yeah. So if you see screening, close your eyes and tick on cross-sectional study. Okay. Let us say, okay, a patient, a doctor just want to find out the opinion of a patient staying on the ward of how the service can be improved. Okay. Out of the 5 options, which option do you think is the most, study? Case report, cross-section, qualitative. Okay, so just look for the magical word. Feeling, opinion, qualitative. Standard, audit. Cross-sectional means screening, prevalence. Case report, rare. If in any MCQ, when you see rare, close your eyes and put on case report. Clear? Okay, so we are going in the right pace. In descriptive, okay, the pros are no control is needed, very inexpensive, it doesn't cost much, quick, and okay. So in MCQs, they might ask, out of this study, which one is the quickest one to do? So any options of descriptive study, tick it. For analytical, I talked about the population, not the individual, the population. In this one, I have seen only one question coming, so you don't need to go in depth. Okay, there's something called ecological fallacy. This is a very common question they ask in the single based question. For example, let us say, take an example. Okay, Italian eats more pizza. Italian have lower incident of suicide compared to European population. So pizza causes suicide. Pizza reduces suicide. What do you make out of from the statement? Anyone want to have a go? What do you get from this one? Italian eats lots of pizza. They lower the incidence of suicide compared. So pizza reduces suicide. Does this make any sense?
No.
No.
Okay, so what they have done is, from the population, okay, from the population inference, they try to compare with individual. Okay, so in any MCQs, if they give an example of, let us say Indian, Indian people are very intelligent. So, you found Mr. Khan, okay, is an intelligent person. Which of the 4 or 5 options would you take? So if they ascribe a population characteristic to the individual characteristic and try to make an inference, that is ecological fallacy. Okay, so in MCQs, just keep in mind, if the populations, inference, if they try to attach with individual, the options will be always ecological fallacy. You don't need anything of this one. Okay. Okay, cohort study. For cohort study, what happens is the exposure happened, but not the outcome. So which study is this? Longitudinal, parallel, prospective, retrospective?
Prospective.
Prospective.
Prospective. Okay, so the question will be, which of the following study would be suitable for prospective study? So which option would you take?
Cohort.
Cohort.
Because the exposure happened, but the outcome hasn't happened. Okay. So for this, the advantage is the selection information. You don't need to select because the exposure have already happened. Okay. For prospective study, you don't have to recall, what happened like 5 or 10 years ago. Okay. So the recall bias won't be there. Incidence means the new cases will be found. Okay. If there's anything with incident, you always calculate with relative risk. The relative risk is to do with biostats, so we'll cover in the next lecture. But always remember, if it is exposure happen, outcome, the new cases, this is incident. Dose response means you can always calculate, how much exposure causes the outcome. Okay. The disadvantage of this study is lengthy. You don't know when the outcome is going to happen. Okay. Large samples might be required for rare diseases. Okay, the problem might be the people who are exposed might just drop out from this study. Okay, and for example, if more surveillance are put on these people, okay, the studies might be, not valid. So just to recap, some of the 5 or 6, different MCQs might come from cohort study. Okay, so let us do 5 or 6 MCQs. Okay, which of to calculate the incident, which of the 5 study out of the 5 study which would be a suitable option? Cohort, case control, randomized, case series, or let us say systemic review.
Cohort.
Cohort, incident cohort. Okay. Which of the study is more, risk of dropout or attrition bias? Expose, outcome has not happened. Cohort. Okay. And from which of the study the relative risk can be calculated?
Cohort again.
Cohort.
Cohort. Okay. So in the MCQs, if you see 3 or 4, close your eyes and tick on cohort. If you see incident, if you see relative risk, if you see dropout, okay, if you see prospective and lengthy, okay, just tick on cohort. So we have done 5 MCQs from cohort. Okay. In case control, the problem is the outcome has already happened. Okay, but we just want to find out the risk that is happened. So which study is this? The outcome has already happened, but we want to find
Retrospective.
Case
retrospective. Okay, so case control is most of the time retrospective. Okay, it's suitable for rare disease. For example, we find a rare disease, for example, syphilis causes memory problem. Now it's rare. Okay, in this case, the outcome has already happened, so we only found for rare kind of thing, case control is good. A lot of the different risk factors can be found. Do you think there's a risk of attrition or follow-up bias? Because the outcome has already happened.
No.
Okay, so if they
Yeah,
ask,
would not be.
which of the 5 study there's a less risk of attrition or follow-up bias, less risk. So 5 options: cohort, case control, randomized, Systemic review, case series.
Case control.
Case control. Okay. For example, since the outcome has already happened, okay, we are just trying to find the risk. Okay. The problem might be if you want to find out like, what happened like 10 years ago, what might be the risk? Recall. Is it clear?
Yeah.
Yes.
Because we are going back. Okay. And over here, since we are in the outcome has already found, there's a prevalence. Okay, prevalence. So in this case, always remember case control, there are two words. So it will be odd ratio. Okay, odd ratio. So keep in mind, you don't need to go in depth. If someone asks you about, which is the best study to calculate the odd ratio, always take case control study. Case control study. Okay, so out of this, let us do quickly do recap, 5 MCQs. Okay, which study is less prone for follow-up bias?
Case control.
Okay, which study is more prone for recall bias?
Case control.
Okay, which one is more prone for selection bias?
Case control.
Case control. Okay, which one is a retrospective study out of 5? Case control.
Case control.
Which one is good for rare disease? Case control.
Case control.
Okay, so we have done 5 MCQs. So if you see these 5 things and they ask which is the study, always remember case control is the one. Okay, now is the experimental RCTs. Okay, in RCT itself, what happens is from this one, we're just going to focus on 2 things. Okay, the RCT itself, I'm going to cover, after the break in more depth. Okay, in RCT, RCT is done in a controlled environment. Okay, and ethical approval is needed. Okay, so let us skip this one. Okay, in systemic review and meta-analysis, this is one step above the RCT. So in systemic review, there are 2 types. Narrative review means, for example, an expert, if they ask you about an expert in particular field, decided to collect evidence of 6 or 8 research paper and try to summarize, that is called narrative review. Okay, so let us forget about this one. I'm going to go in detail. Okay. About that is guidelines. So this is also it doesn't come, but keep in mind, I think in one time they have asked about decision analysis. You don't need to know in detail, but they will keep like 5 or 6 options and say which one is a superior study. Case control, cohort study, case series, guideline, systemic review, or decision analysis. Which one would you take? You take decision analysis because it is the top one. You don't need to know. We don't need to know because it's not in the syllabus.
Is it the same as meta-analysis? Decision analysis are they the same? The 2 of them.
This is above the meta-analysis. The systemic review and meta-analysis means it can be a combination of different RCTs. They might be like 7 or RCT.
Okay.
If you combine the study of RCT, it becomes meta-analysis. Okay. After the result, you need to find out how it is applicable for clinical practice. OK, for that we do guidelines or decision analysis. This is on top of that.
Oh, perfect. Thank you.
Yeah. OK. Now if you are looking at the guidelines, there are also certain way of summarizing the report to make a guidelines. OK, so this might be asked in your extended question. So I'm just going to give you some clues, how to tick in answer. You don't need to know in detail, but if it comes in the exam, OK, Prismus is systemic review meta-analysis reported. So in Prismus, there's M, meta-analysis. So they will ask, which is the best method of reporting the clinical guidance. So they'll give 5 or 6 options, or it might come in an extended question. So if the option is Prismus, there's M, meta-analysis. If there is a quorum, there's a Q, is for quality of reporting meta-analysis. So the option is if there is a Q, quality. Consort, there's a R, okay, reporting trials, RCT. If it is for diagnostic, this is D, diagnostic. Okay, so let me summarize one more time. So these are the way of reporting the guidelines. Okay, so they may ask you, okay, which is the best method of reporting the guidelines? So the options might be 6 or 7. So if it is a meta-analysis, Prism. If it is quality of a meta-analysis, Q. If it is consort, R is there, RCT. If it is a standard diagnostic, D is there. Okay, Strombo is reporting observation study. In observation study, there's always cohort, case control, and cross-section, individual observation. If it is Moses, that is epidemiological study. There's E here. Okay, CORE. This is for qualitative. Q, qualitative. If it is if they ask any question of qualitative, there's a focus group. Okay, the focus group will be covered in the next session. So is it clear before we do in one extended question now?
Yes, thank you.
Okay, so let us do. Reporting meta-analysis of RCT. RCT, which is the option?
Quorum.
Okay. Cohort study. What is cohort study? Observation study. Which was the answer?
Drop. Drop.
Okay. Reporting systemic review. Let us go back. Reporting systemic review. Reporting RCT, R. Diagnostic, D. Quality, this was Quorum. But if it is observation study, it's a Strombe observation study. Epidemiology, E. Okay, so this, it doesn't come, but you need to revise on and on. Okay, so let us recap, what are the things that we have learned so far. Okay, which of the study is useful to measure prevalence? Out of the 5 options, which one would you take?
Case control.
Cross-section.
Yeah. Why?
Because it will give you the prevalence at that
Okay.
point in time.
Yeah.
So it's a point.
Okay.
It's at one point.
Incident.
Cohort.
Cohort.
Okay. So you have to look at the magic word in the MCQs. Okay, so this way I've done it. Now, bias and error. We'll cover in the next 15 minutes and we'll take a break after this. Okay. So these are the topics that we have already covered. Most of the topic in the study. Bias means something problem in the study. Confounders is the third factors. Okay. Okay. So we'll cover in more depth. Okay. There's something called Hill's criteria. Just remember, there are 9, and they will ask, which of these are the options of a Hill's criteria. Okay, so there's no any way, but just have to mug up. Okay, strength means the small association causes the small causation. Some of the study, if they have to be valid, they have to be repeated. If you do it, it needs to be repeated in different person, different places. The strength. Specificity is one cause, one effect. Okay, so I'm not going to go in more detail. Just remember there are 9, and in the MCQs they will ask which are out of the 5 options is the Hill's criteria. So there's no any way but memorizing the 9. So I'm not going to go in more detail on that. I'm going to skip this one. Okay, so this is a tricky question that always comes in MCQs. Okay, so what I've divided is bias. I've divided in 3 options: information, selection, and the rest. Okay, this recall bias we have already discussed. Where did we discuss the recall bias? Can anyone say which study?
Case control.
Yeah.
Case control.
Interview bias is, for example, if you are interviewing someone and if you have, certain perception of the persons, then it might cloud your judgment. So this is more, you do in RCT just to make sure that the person is blinded. Okay. Desirability means social desirable answer. Okay. The heteros is, for example, individual modified. For example, if you are, taking an interview in front of your, your supervisor, you might change your behavior. Okay, so these are four of the options of information bias. So let us do one MCQs. Okay, which one of this is the information bias? The options are recall bias. Okay, and okay, diagnostic bias, membership bias, lead-based bias. Which do you think is the information bias?
Recall.
Recall. Okay, so the MCQs might be, they will ask which one is the information bias. So they are only for information bias. So most of the time they don't ask this two bias. The question will be from recall bias or heteros bias. But good to know that these are also information bias. Okay, so we are about to finish 5 slides and we'll take a break. Yeah. If anything to do with hospital, this is the bias. So this is the selection bias. In selection bias, there are 7 biases. So is hospital, there's Bayesian bias. Referral bias is, for example, the rare cases might only be referred for the secondary services. Okay, there's something called diagnostic biases. That means in RCT they do a lot of exclusions which might not be relevant. Okay, membership bias means like, people, they collect data from self-help group. So that is membership bias. So out of all of this bias, the only bias that you need to concentrate are, if they ask the hospital bias, this is the answer. Okay. And lead time bias is picking early, stop the day. For example, if you find the result that you expect, you stop the study. Okay, that is lead bias. And Nemes bias is incident. Okay, death and suicide. For example, if you want to find out, gunshot, but the people died before coming to the hospital, those data might not be recorded. So this is called Neber's bias. So out of this, the 4 common MCQs that always comes is, okay, they will ask which one of this is a selection bias. So always remember there are 7 and you mark up. Okay, if they ask about the hospital, which bias is it?
Bergsonian.
Okay, and if the box asks about which bias is involved with incidence and prevalence,
Human bias.
Women.
yeah, and we have discussed this in more detail. Okay, so I don't think the other bias they will ask, but if there is a cross-sectional study, remember there's a voluntary bias. Okay. So this is a very tricky MCQs that I put, we have done a bit of bias. A research expectation regarding treatment effect may result in a different interaction with same subject, leading to a chance in subject response of favor of research hypothesis. Out of the, 5 options, which do you think is the right option? Research expectations.
Pygmalion effect.
Which one? This
Pygmalion.
one? Okay. Why do you think this is not an option? This is not an answer.
This is not about incidence, prevalence, difference, or anything like that.
No, Hawthorne is if anybody observes them.
Oh yeah,
They're-
I'm sorry.
For this
Yes.
one, they haven't given the observation of a subject. The subject didn't change the response. This is a research expectation. Okay, so sometimes this kind of question comes, which is not in the theory, the syllabus. So this is outside the syllabus, So if it is about this is a bias with experiment expectation. Okay, so we'll be taking that. Confounders will be covered more detail in the second session. Experimental study. Okay. I'll cover this in more detail. Okay. 2 more slides, then we'll be taking a break. Okay. when we do an RCT, the reason why, the RCT doesn't give the true picture is in RCT, there's a lot of exclusion criteria. For example, if there is a population, there's a sampling and there's a research. The smallest unit of RCT is which one? Can someone take a guess?
Sample.
Sample, yeah. So the MCQs might be in, a study in RCT, which one is the smallest sample? Which one is the smallest unit? So sample, okay, so let us move to the next one. So there are different type of randomization. I've got 2 slides and we'll be taking a break, okay? If they mention something about computerized generator, this is a simple randomization. If they talk about blocks like 6 or 8, that is a block randomization. Randomization is, for example, a population is there. You just divide the population. So the method is randomization. In randomization, you don't know where the population is placed. OK, so this, increases the power of the study. If it is a stratified randomization, they are distributed as per the age and the sex. OK, if it is a cluster, that is a catchment area. OK, so various catchment area. So cluster randomization, can you give an example where the cluster randomization is applicable? Cluster.
Different GP surgeries or
Perfect. OK, so any MCQs that comes with GP, and if they ask, which are one of the 5 options the randomization is suitable: simple, block, stratified, minimization, quasi, or let us say cluster randomization, which option would you take?
Cluster.
Cluster. OK, so if they mention about computerized generator, this is simple. If they mention about 6 or 8, block. If they mention about age and sex, stratified. OK, but minimization is, for example, if someone is found and they refer the next one based on the characteristic, that is minimization. OK, quasi is, for example, you choose a patient depending on odd and even number of date of birth, that is quasi randomization. OK, so the one of the favorite question of MCQs they will always ask is which one of the randomization is less favorable? Which option would you take out of the 6?
Quasi.
Quasi, yeah. Okay, so this is the same thing which we have discussed. Okay. Out of this, always remember snowballing sampling. This is randomization. Okay, so if the question of randomization comes, these are the only 6 options you'll have. But if the same question comes with sampling instead of randomization, the options will be different. Okay, this is probability sampling means simple. Means it will be simple, random, stratified, which we have already discussed. Cluster is GP. So in an exam, out of this, I think these are the only 2 questions that tend to come easily. Okay, if they mention about, for example, if you choose after every 9th or 10th patient, if they give the 9th or 10th, the systemic sampling is the answer. If they mention about, drug user have to locate the next one, the sampling will be snowball sampling. OK, but if someone comes on, voluntary, for example, we do a study and we say, oh, if anyone is interested to come for a study, that is voluntary. Convenience is whoever you find. For example, we do a local teaching and we say, OK, let us correct a feedback. That means on convenience. OK, quota means OK, we'll forget about this one. So in MCQs, OK, if it is randomization, you have got 6 options, but the same question might come as choose the correct sampling. OK, so there's a difference between randomization and sampling. OK, so let us do one MCQs. OK, I think this is the last slide and we'll be taking a break after this. OK, the research chooses to semi-structured close-up in monitoring once every 3 months. All the active companies are registered to attend the clinic, which is the sampling method which you use. They attend whoever is attending the clinical close-up in monitoring every 3 months. Which option would you take out of the sampling?
Volunteer.
Sorry?
Volunteer monitor.
Okay, so we'll keep that in the side. Okay. Another service user who shared the same experience introduced the patient to the researchers. So
Snowballs.
snowball. Attempt to include some highly satisfied service user from some poorly. Okay. The researchers only chooses the highly satisfied service user, which is the option.
Intensive sampling.
Okay, we'll keep that.
Convenience.
Okay.
Yeah.
Okay, the expert, they only try to recruit from the expert wide
Oh, this
experience.
is intensive, yeah.
Intensive. So if it is expert intensive. Okay, so this is the last slide we have. Convenience is whoever we find. For example, we go to the close-up in clinic and we find, people having blood monitoring. We get it. That is convenience. Snowballing means whoever we, like the next one, identify the other one, like drug user. Snowballing sampling. Purposeful is the research has got motive, highly satisfied. That is called purposive sampling. And intense sampling is if it is expert intense. Okay, I'm going to avoid this one. Okay. Okay, so we'll cover this one after the break. Okay, so we already had. Let us take a 15 minutes break. Have tea, coffee, and we'll resume the other one.
Okay, thanks.
Thanks, Theo.
Thank you.
Thanks ever so much, Theo.
Thank you. We'll come after 15 minutes. Just checking. Is everyone here? Okay. So, there was one slide. Namita, are you here? She might be still having coffee.
Hello.
Yeah. Can we start now?
Yeah.
And just checking. Sadi, is it Rabia?
Yes, I'm here. Hello, yes, I'm here.
Yeah. So we have got to cover. Okay. There was just one slide from the last presentation, and it's a very tricky when you do an MCQs. This is with systemic review. There's something called allocation, concealment, and binding. Okay. Has anyone done MCQs and come across this two words, allocation, concealment, and blinding?
Yeah.
Allocation is, preventing selection, and this is done at the time of a selection, but binding is done, from the selection as well. It depends on different stages, but just to remember that allocation concealment is done at the time of selection, and binding can be, um, it's more of like binding is more of like, binding the experimental and the other. So this topic will be covered more detail in secondary research. So in the next 1 hour, 15 minutes, these are the topics that we'll be covering: qualitative research, reliability and validity, economic analysis. With economic analysis, there are a bit of calculations which might come in the exam, and secondary research. Okay, so let us go ahead with it. So type of RCT. So this is one of the favorite questions that Royal College tends to have, by asking, what type of RCT is it? For cross-sectional, what they do is there's a one sample and they will give like 6 or 8 weeks to wash out the effect of the treatment, and they will try the same treatment on the same group of patients. So this is something called crossover RCT. This RCT is only applicable, if the disease is not curable. Okay, so is everyone clear with the crossover RCT? And there's something called factorial RCT. Okay, in fact, factorial RCT, you can see from the picture that the two groups can be divided into 4 different ways, and this is something called factorial RCT. In MCQ, always keep in mind, if they ask what type of RCT is that can be can have 2 by 2 table. So the answer is factorial RCT. And there is N of 1 trial. That means the single subject. So what is the difference between cross over RCT and N by 1 trial? Is in N by 1 trial, there's no any wash over period. So the single, subject from 1 to 6 week placebo, so it goes through it. So in MCQs, if they ask, if it is a single subject trial without any mention of washover period, if they ask what type of RCT is there, is it N of 1 trial. This is before and after trial. One group of this is, like for example, before CRT form and after CRT form. Okay, so they're not going to ask more detail on before and after trial. There are other types of RCTs like uncontrolled trial, genetic modified RCT, non-inferior trial, multiple arm trial, patient inference trial. So this, they rarely ask this, but this can be asked, out of all of these options, which one is a type of a RCT? So if they give, for example, like case series, case control, this and that, and one of them is uncontrolled trial, which one would you take?
Uncontrolled trial.
Uncontrolled, yeah. So the problem with the RCT, or can you take a guess which study was prone for attrition bias? Attrition bias is follow-up bias.
Cohort.
The cohort studies, the longitudinal
Study,
ones.
okay. So there are ways to address the follow-up, follow-up losses. Okay, so this is one of the favorite MCQ question that they always tend to ask. They will give an example and say, which method is used to address the follow-up bias. So intention to treat analysis is if they report out of 50, okay, if they report all the 50, closer to clinical practice, that intention to treat analysis. Okay, so let us take an example of this. If 50 of them entered a study, if 10 of them dropped out, okay, but in reporting, if you report all the 50, even the people who dropped out, it's called intention to treat analysis. If they only report 40, it's called per protocol analysis. This is treatment received analysis. That is, they only take into account the people who actually receive the treatment. Surrogate endpoint is, for example, if they put an imaginary line by saying that cholesterol control is a strong indicator for mortality endpoint. So they create an imaginary endpoint that is called surrogate endpoint. Okay, so let us do a quick MCQs on this. Okay, in cohort study, there was a loss of follow-up. So let us say there were 100 people who entered the study. Out of them, 20 drop out. But in reporting, they only reported 80. Which method have they used to address the attrition bias?
Per protocol.
Or protocol. The other option is they reported all the 50, all the 100. Which method have they addressed?
Intention to treat analysis.
Okay. They said, only 60 of them received the treatment out of 100. And they only reported that.
Treatment received analysis.
And they said that, out of the 100, only 50 improved.
Surrogate endpoints.
Yeah, so keep in mind that there are certain ways of addressing the attrition bias, and they will ask which method have they used. So they will also ask in depth of for example, they have used the intention to treat analysis. That is, they reported everything. So out of that also they will ask what type of intention to treat they have used. Okay. For example, ways of dealing with missing data. A last observation carried forward is, if this is only applicable if it is a rating scale. Okay, screenings too. Screening scales are used. So that is whatever which we have gathered from the last. They report everything. That is last observation carried forward. Worst case scenario is treatment failure. They take into the people who have failed the treatment. If they have mentioned about treatment failure is worst case scenario analysis. Mean imputation is, the data that, for example, there are 50 people who entered, 10 dropped out. But in order to replace the 10, they might use different method to fill up this missing blank. Okay, so the way they do is you don't need to go into depth, but if they mention a multiple imputation, that is Monte Carlo. Okay, and if they ask about different graphs, it can be growth graph, multiple regression, and random method for the missing data. So the question might be, they have used intention to treat analysis out of these three, which they have used. So the three options might be last observation carried forward. If they give a rating scale, the answer would be last observation carried forward. But if they mention something about treatment failure, there is a worst case scenario analysis. If they said that they replace the missing data, that it will be imputation. If they say multiple imputation, the answer would be Monte Carlos. Okay, if they ask about what kind of statistical method, and if they give a graph out of these three, one of them will be the options. Okay, so let us recap, how much we have, learned from this one. Assume dropout in the active arm has a negative outcome and dropout in the control arm have a positive outcome. Which one is our option? This is for intention to treat analysis, and there were three options. The three options will be last observation carried forward, worst case, or imputation. Which one do you think is an answer for the first one? Does anyone want to have a guess?
Last case.
Yeah. There were no change in the available rating after the dropout.
Last observation.
Okay. Assume the source of a dropout were same as the average of the group. They have put the missing data. Which one is the answer?
Imputation.
Imputation.
Okay. So are you clear now? So the question might be for the bias, attrition bias, and they will ask which of the options. So I hope this is clear. Okay, so we have done the first part. Now let us do the qualitative research. Okay, I gave an answer of what is a qualitative study. Does anyone want to give a shout? Okay, let us do a quick MCQ. Okay, imagine I just want to find out opinion of a particular consultant from a group of junior trainees. Okay, which study would I use? Case series, qualitative study, case control, cohort, or RCT?
Qualitative.
Qualitative
Qualitative.
Qualitative, because I'm looking for opinion.
opinions.
Okay, this is to generate hypothesis. We don't know from where to start. So by getting an opinion, we might just see, okay, what needs to be done. If it is a qualitative study, it's always purposeful sampling. So just remember in mind that, if they give an example and which sampling method that they have used for qualitative, the answer is always this one. Okay. There are types of qualitative study, record keeping, we'll go into depth in this one. If it is a focus group, we are going more depth on that. Okay, so this will be more clear in the coming slides. In qualitative study, always remember there are 5 types of qualitative study. Okay, this is phenology is something describing a lot of people like carers. So, for example, we don't know what caring means, so we ask the carers and we generate a study to define what is carers. So this is something called phenography. In MCQs, this is one of the favorite questions that they always tend to ask. Okay, this is descriptive of a culture and the people who have something in common. Imic is individual from a specific culture. Etic is outside the culture. So let us do a quick MCQ. Okay, so they said, okay, researchers want to study a particular culture of a patient, a particular culture of a group of people from within the culture. Okay, which type of qualitative study they have used? Phenography, emic, etic, grounded, case series, or participation research, which is an option?
Mimic.
Emic. Okay,
Emic.
so if they ask outside, this will be an option. Okay, grounded theory. Okay, just remember, most of the time they have asked, who created grounded theory. So I've just given Glacier and Strader. So this is also one of the common questions that always comes, with G, always remember G. Okay. People give different opinion how to organize and generate. For example, with grounded theory, what they tend to do is, there's one example I've kept over here. Okay. So in this one, we want to find out if someone have lost, there are different kind of reaction than they have had: denial, anger, bargaining, depression, and acceptance. But we want to define, what each of this is. So for that, in grounded theory, what we do is we collect data from different theoretical saturation is, we collect all the opinions till no any new opinions can be collected. For therapeutic sampling, fresh data on the basis of new category. So this becomes a baseline. Okay. So for grounded theory, the MCQs that they might ask is, okay, we want a group of researchers want to find out about, let us say, depression. Okay. So they calculated opinion from all the people who suffered from depression till no definition of depression could be generated. So what do you think is an answer?
Saturation.
Okay, so the answer will be theoretical saturation. So if they haven't given this option, but have asked, what type of qualitative study that they have used, which is the answer?
Grounded theory.
Okay, so case study is survey. So if someone mentioned about survey about, feelings, and this is a case study. Participation research is own is, for example, if just someone wants to find about their own culture and this and that, they do the individual study. So this is participation action research. Okay, so let us just quickly recap. Okay, so some of the MCQs question that it can come from qualitative study is they will ask, what type of qualitative study they have used. So the common question is this one. Okay, emic and etic. Emic is from the individual within. Etic means outside, and they always ask about culture. Okay, grounded theory, and this is who invented, and they tend to ask about theoretical saturation. Case study, in-depth survey. And if someone wants to find about their own, this is patient action research. Or one of the MCQs that it has come in the past is, they will give different option and say which one is a type of a qualitative research. Okay, so the options would be a case series, audit, uh, case cohort, RCT, or participation action research. Which one would you take?
Participation.
Okay, so let us go to the next one. In qualitative research also, they will ask what type of methods that they have used for collecting qualitative. If it is a structure, limited range of questions. For example, most of, they'll have a fixed question to ask. It's called structured. Semi-structure is, as a junior doctor, when we tend to collect history, we tend to use the semi-structured, like sometimes if patient gives some information before the other, we tend to go to that. So there's that we order the semi-structure. Unstructured is, you go haphazard. Okay, so this is some of the common question that comes from qualitative research. So this method is also used, when we are trying to employ people, let us say in McDonald's or KFC. So what they tend to do is they don't have time to interview each individual. So what they do is they give a scenario and they will ask like 6 to 8 people to sit around and try to find a solution for that. So this one is called a focus group. So in this, there's not more than 10 people. Okay, greater insight. Okay, when limited resource, this one. So in the MCQs, they will ask, okay, if they give something about focus group and say which type of study is it? Qualitative, case series, RCTs, meta-analysis, or guidelines. Which one would you take?
Qualitative.
Qualitative. And they will ask, what is the maximum number of people a focus group can have? 10. 6 to 10. 10 is the maximum. Okay. Let us go to the next one. Observation is this is something which the YouTuber nowadays use, just collecting the videos. So they don't tend to ask more on this one. Okay, they have asked this one. Okay, this is data collection is just diaries, letters, and formal. And there's something called Delphi techniques. Okay, where anonymous opinions are circulated forth in the census. Okay, so if they ask, which method is used, Delphi method in a study, qualitative, RCTs, case code, case series, or meta-analysis.
Qualitative.
Qualitative.
Qualitative. Okay. Okay, so this is also one of the questions. For qualitative, they interview, they transcribe the data, that they make it something which can be understandable for the research, and the coding is generated. Okay, so there's something called content analysis. Manifest is a basic descriptive account. Latin is a higher. So just remember, manifest is basic. Latin is higher. You don't need to go in depth. No one asks you about this one. Okay. So they have asked this MCQs in the past. Okay, conversation analysis is combining audio and visual and recording and making sense of it. Discourse analysis is autobiography. If someone decides to write autobiography, the type of a qualitative study it comes in discourse analysis, and the software that use is Nudex or Atlas. So one of the MCQs, they have asked in the past is, in qualitative study, no, if someone decided to write a biography, okay, which software is used? So they have given, let us say, PubMed, and the options is Atlas. Which would we take?
Atlas.
Okay, yeah, good. This is a concept which took me a bit of time to understand: reliability and validity. Okay, so from the picture, what do you make of reliability? Does anyone want to give a shout?
It gives you the similar result every time you test it, kind of a thing.
Okay, and what is validity then?
It's near to the true value always.
Yeah.
Yeah. So reliability is more in terms of individual study, how close they are. Validity is more in terms of the true population in the center. In a simple term. Okay. Compare the reliability and accuracy. Okay. So reliability, in other words, is precision. Precision means how close they are to the individual study, the central value. Okay. The more precise, okay, so accuracy is validity, how close they are to the center. So the question might be, okay, reliability measures which of the following options: precisions, accuracy, reliability, some three or four options. Which option would you take? Reliability
Yeah.
will be precisions. Accuracy will be validity. I'm going to come more in depth with reliability and in the coming slide. Okay. So reliability can be different types, and test and retest reliability. What do you mean by test and retest reliability? Anyone want to give a shot?
When we repeat the test again
Yeah.
and again, it will be
Yeah.
almost the similar result.
Yeah, yeah. Parallel, they don't tend to ask this one, so forget this one. Okay. Inter-item consistency reliability. They don't tend to ask this one more often, but inter-rater reliability they tend to ask. What do you mean by inter-rater reliability?
If the two investigators do the test, they will almost get the same result.
Yeah, good. And split half reliability.
Yes, I'm not sure.
You know, in the rating scale, you divide the rating scale into half, and both the half gives the same result. Okay, so in the exam, split half, interpreter reliability and retest reliability are the more often question that comes. To measure the internal consistency of a, so they will ask, you know, which statistical method is used to measure reliability. The answer is always this one. Go back alpha, and they will ask the range. The range will be minus infinity to 1. There's no any method, but just to mark this one in MCQ. This one I'm going to cover next week because it deals with biostats. So we discussed about inter-rater reliability. Okay, I think Shruti have said about that one. So to measure inter-rater reliability, which is the statistical method that we use?
Cohen's kappa.
Yeah, so this is like you know, in any show, there's 3 judges, so it's inter-rater reliability. Okay, if it is random, it becomes 0. So the tricky question now is, for example, if someone wants to measure the inter-rater reliability, which is the statistical method they use, is it Cohen's kappa coefficient or is it Kovacs alpha?
Kappa.
Yeah, so keep in mind, if it is internal consistency, this is the answer and the range is this one. But if it is an inter-rater reliability, it's this one. You tend to confuse in the exam when you are in stress. So inter-rater means you take this one. Validity. Okay, so there are different types of validity. So as we mentioned before, validity is how close they are to the population. Okay, so face validity means, does anyone want to define face validity in their own terms? What do you mean by face validity?
Just on a superficial basis, we feel that, okay, the test is fine.
So if it is a lame person, you know, we say, oh, it measures what is measured is face validity. Content validity is always expert based. Criterion validity is the tool matches with other tools. So it's comparing one rating scales with other. So if the option says, you know, if you are measuring one rating scale with other is always criterion validity. Concurrent means both the scores tends to be same. Discriminant validity is opposite. Predictable is it predicts what the likely answer is going to be. Construct is the tool measure what it is supposed to measure. Internal validity measures what casual conclusion means A causes B. That is internal validity. Is this clear before we do an MCQ? Because a lot of MCQs comes from validity.
Yeah, let's see.
Okay. So this one is a type of validity. Okay. So in the question in the MCQ, if they ask you a type of validity, options might be this one. But what if they ask about the method of a validity, the answers might be different. So keep in mind, if they ask the type of validity, this might be one of the answers. But instead of they ask the method, the answers might be different. So triangulation, what does triangulation means? More than 2 investigator, you know, like two investigator, they compare and see, you know, whether their results are same or not. They don't tend to ask about response validity more often, but this is very common. Reflexibility is in which the research and the research process have shaped the collected data. If they mention anything about previous assumptions and experience, this is always reflexibility. And if they ask about method, this is an answer. Okay, they don't tend to ask about this one. But remember, if they mention something about outliners, outliner is, for example, we expect a result here, but some 1 or 2 results might be here, okay, which is out from what we expect. So if that is the case, that is divergent case analysis. So before we go to the MCQs, does anyone want to ask any question before, the concept of validity is clear? Okay, so let us check the MCQs. Psychologists design a new questionnaire to detect Asperger's syndrome in school-going children. The extent to which the psychometric question measure what it is originally destined to measure is called, what is an answer? Sorry, I've given you an answer.
Validity.
Validity.
If paper B exam accurately indicates the participant scores on the paper B casts taken at the later date, then MSI paper B is said to have which of the following?
Predictive validity.
Yeah. Okay, so this was a tricky question. What does Kovac alpha measures?
Internal consistency.
But if it was inter-rater reliability, what would be the answer?
Kappa.
Kappa. Cohen's kappa.
And they will ask, what is the range of a Kovacs alpha?
Minus infinity to
1 plus 1.
1. Okay, but in exam, don't forget minus. The option might be, without a minus, infinity and plus 1. So in a hurry, you might take infinity plus 1. Okay, I think this is the second last topic that we are going to cover. Economic analysis. From economic analysis, there's a lot of MCQ question as well as, and sometimes they might also give you some calculation to do. In economic analysis, there are 5 types of study that they ask. So if it is a cost minimization, you only compare the input. You don't compare the output. Okay. So the example are, if you want to compare the Oxford COVID-19 vaccine with Pfizer vaccine, how do you compare in cost minimization? Does anyone want to give a shout?
just compare the cost of two.
Yeah, but they don't compare the outcome.
No.
For cost effectiveness, they always measures the outcome with clinical measurement skills. So if they give an example of a clinical measurement skills, then is cost effectiveness. Okay. Cost utility, if they measure the outcome in terms of disability or quality of life. So then is cost utility. Cost benefit is they compare money with money, outcome with money. Okay. Cost consequences is money and the outcome is days saved or this one. Okay, so is it clear? We have got 5 kind of costs economic we calculate. Okay, so just to summarize, cost minimization, they only compare the input, they don't compare the output. Cost effectiveness, the money is there, but if they give an example of cost measurement scales, is cost effectiveness. Cost utility, the outcome is disability or quality of life. Cost benefit is money and money, input as well as output. Okay, cost consequences is the days saved. Okay, so let us do one MCQ just to see how much people have written. Okay, two, researchers use 2 intervention and they use MIDAS screening tool to see which intervention is effective. Which of the 5 options of economic analysis they have used?
Effectiveness, cost effectiveness.
Yeah. The tricky bit now is, the 2 researchers have used 2 intervention and they have compared the outcome in terms of quality of life. Okay? Which are the 5 options of economic analysis they have used?
Then it becomes utility.
Yeah.
Utility, cost utility.
Yeah. So just keep in mind, they will trick and ask MCQs from this. So I've just given you an example of this one, so I'm just going to skip it. And okay, so they might ask about how the cost is calculated. Okay, direct cost is borne from like hospital space, drugs, equipment, salary of a doctor. These are all direct cost. Indirect cost is borne from public. Okay, productivity lost due to cost of having a caretaker for one dog. So this is from the public pocket. Intangible is something which cannot be measured. This is like qualitative, like pain, suffering, social stigma. This is intangible cost. Opportunity cost is, for example, if you guys have not attended this course, you could have been doing a ward job or had some opportunity today. So that opportunity is lost. So that is opportunity cost. Okay, so let us do one MCQ just to make sure that we have written this one. Okay, a person have lost a mother. Okay, because of that the person was not able to come to work. Which of the following method can be used to calculate the cost? Direct, indirect, intangible cost, or opportunity cost?
Intangible.
Yeah. Okay, let us do one more time. Instead of giving a paper B exam, you could have gone for a holiday. Which method of cost can be calculated?
Opportunity cost.
Opportunity cost here. Okay, so so the benefit can be which are money, clinical, and so let us just skip this one. The rating scales 0 and death. Okay. Out of all of this, this one is the most frequent question that they ask. That is the maximum amount that an individual is willing to prevent a cure or disease. For example, if someone has got a cancer, and if someone is asked, how much money you are going to pay in order for you not to have a cancer, that is called willingness to pay. Is this concept clear? Out of all of this, they tend to ask this question very often. So let us skip that. So we discussed about cost-effective analysis. Does any one of you want to explain what cost-effectiveness analysis is? So it becomes easier for us to do a calculation. Input and output. What is an input in cost-effectiveness analysis?
Input is money, but output is measured in scales.
Scales. Okay. So in the exam, they will ask you to calculate increment cost effectiveness ratio. So the formula of this one is what they tend to do is in the up value. Okay, the money is always there. In the down value, it's like effect. Okay, and in the two intervention, you just minus it. So is this clear? If someone asks about increment cost, so let us take an example of this one. For CVT, it costs 1,000 per course. For ATS, it costs 5,000 per course. And in rating scale, in CBT, they have better of 5. In ATS, they have better of 3. Okay, so if someone asks us to calculate the increment cost ratio, what we tend to do is we minus this with this and divide with this and this. So it gives you the increment cost effectiveness ratio. Is everyone clear how we calculate this one now?
Yeah.
And
Yes.
in one of the MCQ question they might ask, okay, the increment cost effectiveness ratio is used. Which one of the 5 option of cost analysis have they used?
Cost effectiveness.
Okay, so from one, you can learn 2 or 3 MCQs. Okay, so what curve is this? Has anyone seen this curve before? This is cost effectiveness. In cost effectiveness, what happens is in the y-axis, all the money is there. This is x-axis, and in y, there's a rating scale. Okay. So in an exam, if this curve comes and they will ask, what curve have they used? What would be your answer?
Cost effectiveness, acceptability curve.
Okay, and over here they will ask, okay, if a person has paid 20,000, okay, so this is the doctors, this is the nurse, okay, how much effectiveness is seen in doctors group if
Roughly
someone had paid 20,000?
0.8 roughly.
Yeah, so in an exam, just use this one and this one, okay, and they will ask, okay, for nurses, the maximum willingness to pay is 45,000, okay. What is the effectiveness? You can see from the graph. So there will be a different option.
0.1.
0.1, okay. So this is the way to interpret this graph, okay. And in cost effectiveness, they are going to use willingness to pay, okay. So the other question, let me just, sorry. The willingness to play is used in which of the five, economic analysis? Which one would be your answer?
Cost effectiveness, acceptable.
Okay. So I'm just showing you an answer, example that from one you can do 5 or 6 MCQs. So okay, so let us go to the next one. Cost utility. Does anyone want to explain about cost utility? So the input is
Money,
outcome is
quality of life.
quality of life, and this. Okay. So in this also they calculate the increment cost. So increment cost is basically the same. But instead in increment cost, what they tend to do is they just multiply. So they will give you a value of quality 0.1 and they will give you a money and they will ask, calculate the increment cost gain, which is quality utility. So in MCQ, you just multiply this two, which will give you the increment cost gain on extra QA. Okay, so in MCQ, let us do QA. Which of the method is used to calculate the QA out of the 5 options? Cost benefit, cost utility, cost effectiveness, and 2 more options.
Utility.
Utility. Okay, and if they ask you to calculate the increment cost, just multiply the cost with the QAL and that will give you an answer. This plane they will not ask. But if they ask you about this one, this is cost effectiveness plane. If they put this one and say which one of this is used in economic analysis, the answer is cost effectiveness plane. Okay, so we have got some MCQs. Okay, an open label randomized trial compared 10 patient on clozapine with 10 patient of physician choice medication. Which one is an answer? Okay, so this is more of like a calculation. So, okay, so this is the whole question. 6 out of 10 patient of clozapine achieve remission and 5 out of 10 patient have everyone got a piece of paper?
Yeah.
Okay, so this is a question. This is a long question, and this is the question that there are 4 options. Would people take like 2 minutes to do this, and we'll discuss it if this comes in the exam. So I'm going to time it 2 minutes. Just let me know when you finish.
Yeah.
This question I have repeated numerous times, the same question. If you guys have finished, just raise your hand. There's a raise hand button. Has everyone done it?
Yeah.
I've just got 12 slides after this and we'll be done for today.
I think you should start with it. I'm very clueless about this. I know we've discussed it, but I'm not
Yeah,
done.
even third and four, I'm like struggling.
Okay.
That's me as well.
So the way we calculate is for the 10 patient taking clozapine, this is the one, and 6 remitted. So we subtract. So this is the answer for the first one. So let us look at the question. The cost per patient remitted on clozapine. Remitted on clozapine. So this is for clozapine. This is for the other antipsychotic medication. So for this one, the money for clozapine is this one. So you multiply by 10 divided by 6. That will be given remitted of clozapine. If you want to calculate the antipsychotic, what you tend to do is this is the money for the other antipsychotic. Multiply by 10 divided by 5. That will give you the answer for this one. Okay. So are we clear with the first and the second?
Yeah.
Yes.
So the question now is the third one asks for the increment cost of clozapine to achieve one additional remission. Okay, the the increment cost of clozapine per symptom free. So per symptom free is for this one. Okay, so let's see for the one. For one additional for 10, you compare the 10 compare with 10 antipsychotic. So if you see on that, you are comparing 10 patients of clozapine with 10 patients of other antipsychotic. In remission, 6 out of 5. So achieve 1, you just minus this one. Okay. And from this one, the 30,000 with this one you minus and divided by 1, you get the answer of this one. Are you clear with this one now?
Yeah.
Yeah.
Okay. But if they ask for the symptom free month, then you have to use the clue for the option that is given. For symptom free means you have to minus this with this, it will be 50. So the options which you have got from the above, you divide it by 50, you get the answer. So that is an answer. So the trick in this kind of MCQs is If they use symptom-free month, try to use this clue. If they ask for one additional, you just if this, most of the time this and this will be same, you just minus this one and try to divide with this one. So it gives you an answer. Clear?
Yeah.
So a lot of the question will be in economic analysis. So, once we finish the session, what I would advise is try to do as many MCQs as possible with economic analysis. Okay, so I've just got like 10 slides and we are done for today. Secondary research, okay, which I've already discussed. Narrative is the expert. Systemic review, which we have already done, meta-analysis without meta-analysis is most of the time is RCT. If it is without a RCT, it will be, qualitative and this one. So let us not go into detail. Has anyone come across the term heterogeneity and homogeneity?
Yeah.
Homogeneity if the studies are similar, same. Heterogeneity if there's some difference and variation. Okay. When you compare, especially studies like RCTs, compare in meta-analysis, these are some of the terms that you are expected to comment on when you do a critical appraisal. Sample size, precisions. I'm going to ask you an MCQ just to make sure how attentive you guys were. Okay, precision, is it with reliability or is it with validity?
Reliability.
Validity.
Okay, external validity. Okay, with generosity. Okay, external validity, is it with effectiveness or efficacy?
Effectiveness.
Yeah, and pragmatic study has got more external validity. Okay, so clinical heterogeneity. What do you get from this picture? What are they trying to compare?
Both are apple, but color is different.
Different. Okay, but can you measure both apples? Can you measure and say you can only describe the color if you are just asked to comment on color. Can you measure the color?
No.
Yes, one is green and the other is red.
Yeah.
You can't.
But it's describable, not measurable.
That's right.
Okay, so this is an example of clinical heterogeneity. The example is COVID-19 vaccine given in a Chinese population and European population in different RCTs are combined. What kind of heterogeneity is it?
Ecological.
I'm not talking about the bigger population and the individual population. The population are same, bigger population, Chinese population and European population. Okay, I'm talking about what type of heterogeneity is it?
Racial.
Racial, but it comes in a clinical heterogeneity, which can only be described but not measurable. Is the concept clear? In MCQs, they will ask, what type of heterogeneity is it? If it is describable, not measurable, is always clinical heterogeneity. What do you get from this picture?
Different type of sports.
Yeah. Do you think the methods are different?
Yeah.
What will happen if you combine a cohort study of a CBT with RCT of a CBT and medical intervention? Are the methods same, RCT and cohort study?
No.
No, they're different methods.
Different.
No,
So it was methodology heterogeneity. So in the MCQ question, let us put case control study of CBT is compared with R-city of olanzapine, which type of heterogeneity have occurred? 5 options.
Methodological.
Methodological, okay. Statical is, what do you get from this picture? If the same trial, okay, is different, done in a different population and you get a different result, what do you think that is? Is it consistent?
No.
Okay, so in that case, it causes statical heterogeneity. Statical is with numbers. And to, in order to address that, we need to use fixed or random model, effect model. Okay, we don't use analysis in clinical and methodology, but we use fixed and random in statical heterogeneity. Is it clear?
Yes.
So in MCQs, they will ask, okay, our fixed effect model has been used. Which type of heterogeneity is does it address? Clinical, methodology, statical heterogeneity.
Statistical.
Statical. Okay, so I've got 4 slides and we are done for the day. But there's a difference between fixed effect and random. Okay, you don't need to go in detail. This will be covered in the next biostats. Okay, so there are 3 types of heterogeneity: clinical, methodological, and statical. Okay, in statical heterogeneity can be detected by 3 graphs: forest plot, labella plot, and glavular plot. Okay, so in the MCQs they will ask, okay, to detect a statical heterogeneity, which of the following graphs can be used? Forest plot, funnel plot, cost effectiveness plot, and 2 other plots. Which would be the answer?
Forest plot.
Okay, so just remember 3. Thanks. So this doesn't come. Okay, so has anyone seen this plot before? What plot is this?
Funnel plot.
This is a funnel plot. Okay, this plot is for publication bias. And the questions that they can come is, okay, the smaller studies, where are the smaller studies? Is it here or here?
Down. Below.
Down. Okay, I'm going to come in the graph in the next one, but the MCQs are, which of the plot is used to address the publication bias? The answer is
Funnel.
funnel plot. Okay, but if they don't give you a funnel plot in the option, the option will be this one: fail safe and file draw. Okay, so we are done for today. Has anyone got a question for this week?
Thank you so much.
Thank
we
you,
have
Dio.
covered a lot here, and the critical appraisal is a very dry topic.
I know.
No matter how
really
much
a
I try
good
to make
recap.
it interesting,
Okay,
it's
Dio.
very dry.
You covered it really well.
Thanks, Dio.
Yeah, it was a really good recap, dear.
Okay, so what I would advise is, all the theoretical knowledge we have done today, keep it in mind and try to solve all the MCQs related with the theories that you have learned. So the whole week, if you just cover everything from research, the next week I'm going to do the 2 other topics, so you can do all the MCQs from that. So it will take you 2 weeks to cover all the critical appraisal. So 1 week before exam, if you do it instead of 2 weeks, it will only take you like 3 or 4 days to do all the MCQs of critical appraisal.
Yeah.
Okay, so we are finished.